Did you know that palliative care is a human right? Well, you do now. In this video, I'm going to explain why palliative care is and should be a basic human right, and what palliative care is and why it matters. To start off with, what on earth is palliative care? Well, contrary to popular belief, palliative care is not all about dying. Well, let's rephrase that. Dying is a part of palliative care, but it's not all that it is. Palliative care is actually mostly about living. It's about living well, quality of life, symptom control, and good end-of-life care and having a good death. Anyway, going back to what palliative care is. Palliative care is a holistic care of a person with a life-limiting or life-threatening illness. It's about symptom control, managing distress, improving quality of life, and making the most of whatever time the person has left. It takes into account all of their needs, not just medical, but physical, emotional, social, psychological, and spiritual needs as well. It also takes into account the legal and financial issues of living with a life-limiting illness. I'm going to share with you all the World Health Organisation's definition of palliative care. It says, palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with a life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other symptoms, physical, psychosocial and spiritual. Palliative care provides relief from pain and other distressing symptoms, affirms life and regards dying as a normal process, intends neither to hasten nor postpone death, integrates the psychological and spiritual aspects of patient care, offers a support system to help patients live as actively as possible until death, offers a support system to help the family cope during the patient's illness and in their own bereavement, uses a team approach to address the needs of patients and their families, including bereavement counselling if indicated, will enhance quality of life and may also positively influence the course of illness, and it is applicable early in the course of illness in conjunction with other therapies that are intended to prolong life, such as chemotherapy and radiation therapy in cancer treatment, and includes those investigations needed to better understand and manage distressing clinical complications. So, who needs palliative care? Palliative care is thought of as only being applicable in the last weeks and months of life for someone with a life-limiting or life-threatening illness, when in fact it can be started right from the point of diagnosis. Palliative care is about addressing all of the needs of a person with a life-limiting and life-threatening illness. It can reduce symptom burden, improve quality of life, and it can actually even prolong life. According to the website Health and Human Rights Resource Guide, of the 58 million people dying annually, at least 60% have a prolonged advanced illness that could benefit from palliative care. Around 80% of people dying annually could benefit from palliative care to alleviate symptoms and suffering in their final days. Unfortunately for many, palliative care programmes are either inaccessible or unavailable in their country. Quoting the Worldwide Hospice Palliative Care Alliance, they said in 2011 that only 136 of the world's 234 countries, which is 58%, had one or more hospice palliative care services. However, in 2011, only 78 of the world's 234 countries, which is 33% of the world's countries, had no known hospice or palliative care services. For children, palliative care services around the world are even less available. The International Children's Palliative Care Network found that there are around 20 million children who could benefit from palliative care. Sadly, less than 1% of these 20 million children will receive the palliative care they so badly need. They also often do not have access to pain-relieving medications in children's formulations, leaving children suffering and dying in immense pain. So, is palliative care a basic human right? The Prague Charter, which was a campaign by multiple international hospice and palliative care organisations, who are campaigning to ensure that palliative care is a basic human right, have said, access to palliative care is a human right under the right to the highest attainable standard of physical and mental health. Why is that so? Well, if we consider the right to health and the right to the availability, accessibility, acceptability and quality of healthcare, as stated in Article 12 of the International Covenant on Economic, Social and Cultural Rights, that states that everyone has the right to the enjoyment of the highest attainable standards of physical and mental health. It can then be argued that palliative care, as a vital part of healthcare, is included in the right to health and in the right to the availability, accessibility and quality of healthcare. Palliative care should be available to all, regardless of location, of race, of class, of gender, of religion, and regardless of personal situation. There is also the prevention of inhuman and degrading treatment, which is enshrined in human rights laws around the world. It could be argued that not providing palliative care and not having access to adequate pain relief could be classed as inhuman and degrading treatment. What do you think? Do you think palliative care is a basic human right? And do you think that not providing palliative care and not providing access to pain relief constitutes inhuman and degrading treatment? Well, I bored you silly with facts and statistics. Now let's get on with some real stuff. Now I'm going to tell you why I think palliative care is a basic human right. I'm 24 years old, I'm from the UK, and I have a progressive, life-limiting condition. I've been receiving palliative care since I was 17, which is now over 6 years. I live in the UK, where we have great access to hospices and palliative care services. We have our NHS, which provides universal health coverage too, so I'm not put in a difficult financial situation by having the care I have. Being in the UK, I do have access to the palliative care services and the hospices that I need. I have a 24-hour care package provided free of charge to keep me alive and at home. I have access to strong opioid painkillers, fentanyl, in forms that I can absorb as my gut has failed and I cannot take tablets. I have them in buccal, so it absorbs in my mouth, and I have it in a patch form, so it absorbs through my skin. I also have access to intravenous paracetamol at home. These combined help manage my pain, but I also have other medications to manage other distressing symptoms, such as nausea and vomiting. I have access to the equipment I need. I have access to the care I need, free of charge. I have the support to live at home. There is support for my family. And I have all of this without being put in a difficult financial situation. In the UK, we have fantastic access to hospices and palliative care services. Many of us receive palliative care from very early on in our illnesses. This healthcare and the palliative care is provided free of charge, meaning we are not saddled with unsurmountable debts just to have the care we need. In the UK, healthcare is a human right, and palliative care is a vital, utilised and recognised part of healthcare. Thus, it could be argued that palliative care is a basic human right for people in the UK. However, if I were living in a developing country, I would likely not have access to some, let alone all, of the palliative and hospice services I receive thanks to living in a rich, developed and advanced country. I would not have the access to the pain relief I so badly need to manage the cruel and painful symptoms I suffer. My life would be slow, painful and torturous, as would my end of life and death. It would end in a very bad death and a very bad experience for myself and for my family. If it is my right to palliative care in the UK, why is it not the right of everyone around the globe suffering with a life-limiting or life-threatening illness to have access to palliative care too? Why should location, religion, race, class or condition prevent people from accessing palliative care services? Why is their life, quality of life and comfort less important than mine? Many countries don't have access to palliative care services at all, which is shocking. Many more don't even have access to pain-killing drugs such as morphine. How can this be in the 21st century? Many people in lower and middle-income countries do not have access to palliative care services, or where they do, these palliative care services are too far away, or their condition is not seen as eligible, or they cost too much for the people to financially manage to afford it. It's hard enough for adults, let alone for children needing palliative care. Most countries don't have any provision for children's palliative care, nor the pain relief in children's formulations. These children are living and dying in pain unnecessarily. I live in the UK where I have access to the palliative care services I need. I'm supported by a hospice. I have access to the pain relief and other drugs I need to manage my symptoms. I have a home care package, and I have the support and care I need to remain at home with my family and have my symptoms managed. I will not die alone, in pain, suffering horrendously, and my family will not be left to carry the burden alone. Palliative care is a basic human right. I implore all governments to ensure that palliative care is available freely to all who need it. Thank you for watching.